From there we move to number 2. The doctor has now seen the patient, and step 2, the doctor now has to communicate with the biller. Now, we're speaking about a bill, so the doctor has to give the information that would be on a bill.
If you think about bills in general, it has to have a date, it has to demonstrate for what the doctor is billing. So obviously it relates to a patient because it's going to an insurance company, and it has to have the insurance information so that the insurance company can properly deal with it.
Or, to really put it very simply, the doctor has to give the demographic information of the patient to the biller. But now we get to the big question, what is the doctor billing for? So there are 2 things which a doctor has to convey to the biller. The first is what the diagnosis was. What was wrong with the patient? And because the doctor made a particular diagnosis, what is it that the doctor did? What service did the doctor provide? What procedure did the doctor go through? So these 3 things constitute, at the theoretical level, what the doctor has to give the biller so that the biller can try to collect the money from the payor.
It's very nice to say that the doctor has to submit his diagnosis and his procedure, and you kind of conjure up this idea that maybe the doctor has to send a singing telegram like, Mrs. Jones came in on Tuesday and she had a sore throat, and by the way, while she was here, I also checked her ears, etc., etc., etc.
And then I gave her a throat lozenge and whatever else the doctor did. But I think we can all agree that that would be highly inefficient. So in order to really be efficient, both in terms of the doctor not having difficulty in conveying this information to the biller, and so that the payors or the insurance companies or the government should be able to accurately deal with the various treatments that are given by various doctors, it was inevitable that there be a set of codes both for diagnosis and procedure that would be developed. The diagnosis codes are 3 alphanumeric characters followed by a decimal point and 1 digit. Those are the ICD-9 diagnosis codes, of which there are over 14,000 variations. In fact, as we sit here today, ICD-10 is in the middle of being introduced, and it has over 60,000 variations. But whether you're speaking about ICD-9 or the future and ICD-10, they all relate to diagnosis codes. Procedure codes are CPT codes, and they are 5-digit numerical codes. In our quest for efficiency, typically doctors do not want to have to remember all of the ICD and CPT codes and or try to figure out which of the normal diagnoses they made that day and which of the normal procedures they did. So it was almost inevitable that someone would come up with the idea to take a piece of paper and put down a particular doctor or a particular specialty's diagnosis codes and treatment codes, and just allow the doctor to circle or check off the particulars for a particular encounter with a patient. And that would be a bill, but being that it has everything on there, and the doctor only limits what he's going to bill to what happened at that particular encounter, pre-printed forms were developed and are constantly being developed for certain practices and certain doctors, and these are called super bills. Not really a big surprise. Super bills are used by most medical disciplines. However, there are some doctors that in fact send notes. They send handwritten or dictated notes to the billing company, and the billing company uses coders to read the notes and determine the proper ICD and CPT codes. This happens in cases where, like surgery, the doctors have a broad range of the diagnosis codes, a broad range of the billing codes, and I presume in part because they're making so much money that by the time they're done with a day of surgery, it's just easier to dictate notes, which they have to have anyway, and allow the coders to determine the bill.
So certain practices or medical disciplines still send notes, and for those you need coders. It happens to be, and let me point out here,
that a responsible medical billing company will have personnel that are facile, that are knowledgeable in coding in any case, even if doctors are using super bills, because we can tell you from experience that super bills are not foolproof. And it doesn't necessarily mean that the doctors are collecting as much money as they should for particular procedures. To help reduce the abstract to the concrete, you can take a brief look at what a sample super bill looks like. Please note the designated area on the flowchart.